Hi everyone, it is such a pleasure to be back for British Vogue's Speaking Up series, and this one is one that is very close to my heart because it is in celebration of World Mental Health Day. So for today's roundtable, I am joined by actress, producer, writer and mental health advocate, the amazing Lena Dunham. I'm also joined by Dr. Kestel, who is the Director of Mental Health and Substance Abuse at the World Health Organization, and the most beautiful and wonderful Dr. Ciara Dockery, licensed clinical psychologist, Director of the NFL Lifeline, and Chief Clinical Advisor for my organization, Gurls Talk. I am so thrilled to have these dynamic women joining me to hold an important discussion on how the global pandemic, as well as worldwide protests in response to racial injustice, have affected us, and especially the impact that it has had on women and young people as a whole. So thank you, all three of you, for joining me virtually. It means the absolute world. So my first question is to Dr. Dockery. I was about to say Dr.
Ciara, Adwoa, please.
Yeah. Lucky to have multiple doctors, so.
Yeah, I know, it's really hard. And Dr. Kestel, so the pandemic has had psychological impact on everyone, but we've seen that young people especially have been affected. Can you share what you've seen as it relates to this?
Thank you, and allow me to say thank you very much for the opportunity to join you all today. Indeed, the available data we have indicates that young people, together with women, precisely experience the highest toll on their mental health during this COVID-19 pandemic. And many of them are then reporting distress in different ways, in different modalities. And specifically for the younger ones, the school closure, the social isolation in many cases, the limitations in the opportunities to interact, the perspective of financial deterioration or the current one in many cases, loss of lives of people close to them, all that has huge repercussions on young people, families, peers. The pandemic, in a way, has worsened existing mental health problems for many of them. And before COVID, we know that between 10 and 20% of the world's children experienced mental health problems, and most of them do not receive any access to services or to support. So now we see this exacerbated with the differences between, of course, the level of income in the country or in the community, right? Those in less better off communities will be more affected because what we are doing right now is not possible everywhere for everybody, and so that will have a stronger impact. On the other hand, and then I'm finishing. What I see during this current situation is that there is more participation of youth in general, of young people globally for different topics, for different issues, including mental health. Promotion of mental health, supporting the psychosocial well-being within families, schools, communities. Young people have championed, in a way, are championing the need to raise awareness and to move beyond the stigma that it is associated with mental health everywhere, again, with some differences among countries.
No, we see that a lot, don't we, Ciara, in regards to Gurls Talk and the community. And it's such a beautiful concept in itself that something so paralyzing as mental health can be, and with the youth being so largely affected by it, that they're turning it on its head and advocating for it. And also, I think it's wanting to see such major changes. And, we very much at Girls Talk really ask our community what they want. And I think they very much lead the conversation in regards to mental health and in regards to education and storytelling. But
Absolutely.
it's really nice, although, terrible in terms of like not wanting anyone, empathizing for anyone who's going through this right now. It puts a fire in my belly to know that we're surrounded by, communities all out there who want to see major changes in regards to the stigma surrounding mental health. But I was
gonna add on. I mean, Dr. Kestel brings such a global perspective about what's going on, right? And, I'm in New York in the US, Adwoa, you're in the UK, but I just love sort of that idea of that if there's one thing good that will come out of this from a mental health perspective, it'll be more conversation, stigma reduction. We have people like Lena telling their stories, which just helps hugely in terms of the landscape. But I will just add to what Dr. Kestel was saying, the mental health effects of this pandemic. I think when we get through this and we kind of look back historically on this, I think that the mental health effects are going to be a huge, huge part of the narrative as to kind of the larger impact of the COVID-19 pandemic. And, the CDC in the US just in August released some of the initial data around mental health for the second quarter. So we're looking at kind of April, May, June. And comparing that time period from in 2020 to 2019, we were seeing anxiety symptoms at 3 times the level. This is just the general population in the US. We were seeing depression symptoms at 4 times the level compared to 2019. And then if we look at the data specifically for young people from the CDC, and they were looking at young adults, so like 18 to 24, 62% of young people are reporting significant symptoms of anxiety or depression or both. And that is huge. And I really think we need to start talking about them as a group that needs care and focus. And also in that data, 1 in 4 of that group, 18 to 24, 1 in 4 had serious thoughts of suicide in the previous month, in the month of June. So, when we talk about mental health, we talk about frontline health workers, we talk about minority groups that are kind of disproportionately carrying the burden of this. We talk about caregivers, and we talk about people with previous psychiatric conditions and how they are kind of all at risk. And I really think we now, when we're looking at the data, need to start talking about young people and young adults and attending to them because they are hugely impacted from a mental health standpoint.
And Lena, I know we spoke briefly before we entered into a bigger conversation, but I know that you have been putting yourself out there in regards to your own story and what you're going through. And you said that your community and your followers are really sucking up that information. And I'm wondering if you can go a little bit deeper into that because you're seeing it from a different perspective, I suppose.
Well, thank you so much. And it's such an honor to be here with these women and today and for this cause. And I've admired what you've been doing with Gurls Talk for such a long time. And it's been such an inspiration for me in terms of the idea that social media can be a positive place where you're actually creating community and you're not just creating this sort of divisive conversation. Because for me, for such a long time, my mental health involved separating myself from my social media. And you actually were such an inspiration for me for reintegrating with my social media and finding community with it. So thank you for that. And it's been such a great thing for me during the pandemic. So you're probably single-handedly responsible for that. And thank you to these amazing women for the information we're getting today. At the beginning of this pandemic, the biggest thing I thought as a person who as a storyteller has always wanted to be open about the fact that I've struggled with obsessive compulsive disorder and a diagnosed anxiety disorder for the majority of my life on this earth. And that's something that I've overcome, through various methodologies, whether it's therapy or mindfulness or medication, but really I've overcome it through community and through sharing my story and receiving other people's stories back. And then when I also became sober 3 years ago, that was something that really involved community to do, because I think, sobriety is something that no matter how you get at it, whether you do it through a traditional 12-step model or another way, community is a really beautiful way of finding that, substances don't have to dictate the pattern of your life. And so my biggest concern when the shutdown began, when the lockdown began, was what are young sober people going to do who have become basically as addicted to human interaction and to positive human interaction as they have to using drugs, like to showing up and engaging with each other as they have to using drugs. And it terrified me. And so my thought was, maybe actually we can start speaking in a way that's honest with each other and using the internet in a way that feels healthy and loving. And I have been really, really heartened, not just by what I've seen on my social media, which has been women sharing about everything from their day-to-day pandemic anxiety to their longer mental health journeys, but also in my personal world, the way that people have used, technologies like Zoom to come together and keep their sober communities alive, keep their mental health communities alive, keep their ways of sharing and connecting alive, instead of giving up and receding back into old patterns of isolation and in quarantine. Because I know that if I'm not watered by that kind of human contact, I have real isolatory human behaviors that I can find myself in. And it's been a really amazing time for me to not rely on those old patterns, but to actually stay engaged with the people who I've come to rely on in my new and improved model. I think the thing that does break my heart for, I'm going to say young people, because I feel I'm 34 and I feel so incredibly old now, is seeing that right now, the state of fear in the world and young people having to basically make the choice to sit at home in isolation and be safe from this virus, or band together in the streets and protest against, racial injustice. It's like, that's not a choice that young people should be having to make. And that is, especially in America, that's on our government. And so that's on the way that this has been handled by our government. And it breaks my heart that, my younger brother is 6 years younger than me. And it breaks my heart that his generation of activists have to make the choice to expose themselves to a mishandled pandemic and protest together, or stay home and not express their outrage at one of the darkest moments in American history. And so that's of course another angle of this that I think we're going to be seeing. We're going to be seeing more and more come out also about the intersection of these current events on the mental health of young people and marginalized young people and young people of color. And that is something that is going to be, I think, a part of our history books.
100%. And I really resonate with what you said about isolation, because I remember speaking to Ciara at the beginning of lockdown, and it was so hard because I very much associate isolation with my darkest times of depression. And when I've pulled away from, human interaction and have had to be in my house, it was always because I had no other choice but to kind of, the depression had taken over, and it felt like the only option. So having to do it because of a lockdown and a pandemic was really strange, because I had to turn it on its head and look at it in a different way. But I was so used to associating isolation with depression. And I thought about lots of other people who must be kind of dealing with it in that way as well. Dr. Kestel, you're the director of mental health and substance abuse for the World Health Organization and have had over 25 years of experience in this field. What are some of the unique mental health challenges you've seen this year, and what is the World Health Organization doing to overcome them?
Thank you. It's made me sound a bit old right now with all this talking about youth, but it's true. I have all those years of experience among other issues. And I think that what we have seen is what you just described, both of you, I mean, all the three of you actually. At the very beginning of the pandemic, what we were saying is we were used to emergency situations that were happening somewhere else or to somebody else. So it was, oh yeah, that is happening, but in a country I don't even know the name. Or it's a crisis somewhere else. So it was always others suffering. The particularity of this pandemic situation is that it developed in high-income countries. We got to know, originally in China, but then it got immediately to Europe, for example, and we saw the impact that was having on them, as we know right now, is everywhere. And that means that if the situation is broad and is big, it is not discriminating in a way. It is affecting everybody, everywhere, no matter who you are, no matter where you're coming from. Of course, the possibilities of navigating through this situation are different if, as I said before, we have the possibility to talk. I like Lena's comment about sharing my story and receiving other stories. I mean, that possibility, what you were saying about isolation, that is crucial, right? Because it allows us to navigate the challenges. The fact that we know that everybody else is more or less facing those same challenges, it helps. It's different when you are the only one isolated as when everybody else is isolated. So it positions you differently, and we can discuss that later. But anyway, so I think that's part of the big difference that we have seen. The issues that were mentioned before in terms of the fear, the anxiety, the uncertainty of the future, which is the main issue for youth. I think that the uncertainty of the future is bigger than the isolation or the challenges we face now. Is what is going to be of me later on. I met kids in this month that came back home from their college because colleges were closed and I don't know if they will graduate, how, when. Somebody saying, yeah, I was today at the graduation of my son who had the entire plans developed for that and instead was at home with mommy and daddy receiving the prize. So, I mean, that is impacting, and then what's coming next, right? So that is a bit the first part of your question, that is what do we see globally? Again, those vulnerable groups or countries or situations are having different kinds of challenges in everything that I just said, right? Including the communication. However, there are good solutions and alternatives, the same ones that you put in place individually that mentioned. Others are doing it for the community, trying to activate the community with all the safe measures that are needed and trying to promote that interaction even in the lockdown that is happening. From our perspective, we developed a number of tools for the community, for the public, how to be healthy at home, how to self-manage your own stress. We developed, based on scientific evidence, with all the rules that are out there, a tool for stress management, self-management. We developed a number of other guidelines for health workers, for people working with elderly, with old people in homes or similar situations. A number of tools for the public. We then also did a lot of work of more professional work. I mean, what do professionals need to know? What those that are working in a health setting, taking care of people with COVID, what are the implications from the COVID itself, the direct implications of COVID to the mental and the neurological issues of people, issues about substance use, as Lena was saying before. So that a bit of packages for the knowledge updated, quickly analyzed, and put in place in an easy way to be digested by those that are so super busy. We launched a survey of existing mental, neurological, and substance use services right now in the middle of the pandemic. What are countries doing? Are services in place for those who need, those with previous problems or those with new problems? Do they have where to go for help? Do they know where to call? Do they know where to get the medicine? Do they know how to go and talk to somebody if they don't have their network already available? So we also assessed that, hoping that by analyzing the situation, we collected information from 130 countries. And so by analyzing the situation and giving the results back to those countries, the governments will be able to react properly. So a lot happening, a lot going on. It's quite an intense period. And I wanted to mention something else, that is, we believe that emergency situations are an opportunity. And this we should see it as an opportunity to do something better, more and better. So I'm an optimistic, and I think that there is look at what we are hearing right now and listening about all the stories. So I'm sure that we will do better and more.
Thank you, Dr. Kestel. And I know, Ciara, you drive this home in any of our Girls Talk Zoom meetings, but this idea that the information we put out there, we have to back it up with steps and resources in order for our community to be able to know what the next steps are and what's out there, in order, if they're willing and if they want to ask for help. But as a suicide prevention expert, you've studied the effects of isolation on people's mental health. How might physical distance impact our mental health? And to what extent has the pandemic exacerbated pre-existing conditions of those who already struggled with their mental health?
Sure. I mean, Adwoa, I know we were kind of in close contact when this was all unfolding. And certainly I remember the first moment I heard this concept of social distancing, and my heart sank, and actually like my stomach turned in some ways, because in the suicide prevention world, like I'm on a roadshow all the time talking about how do we reduce isolation? How do we increase connectedness for folks who are at risk for suicide, but in general in life? So the minute that came up, I was sort of like, wow, okay, this is going to be quite tough. This is going to be, certainly we have this subgroup of folks who are already struggling potentially with depression, with suicidality, whatever it might be. And how are we going to keep eyes on them, keep them wrapped around in services from a distance? How are they going to stay connected with the people that help keep them safe? All of that. But then also imagining, wow, all these people who are actually coping pretty okay with life are now going to be faced with what it feels like to be isolated, the huge change in their daily life that was going to happen. And I just love that Lena led with how intentional we have to be about staying connected, and finding creative ways to do that. And I know it is not fun and it is not easy to set up Zoom calls at the end of the day with friends when you don't want to, or, to get on another computer thing or whatever it might be. But, the effects of this over time, it really creeps up. The isolation, it creeps up on you. The little interactions in life, I live in New York, so just riding the subway, just going to my local deli or seeing the dry cleaning or like seeing my coworker, all of that was part of an infrastructure that was helping me feel connected and part of community. And like in an instant, boom, all gone, right? And that's happening for everybody. So there's many pieces to it. I think initially we were saying, okay, we got to stay connected during this lockdown. How do we do that? Like, how do we Zoom? You got to make plans? You have to, all of this. Now this is going on for a long time in terms of these more long-term changes. And we all really have to acknowledge kind of that is going to impact us, and that we really do, like Lena is doing, have to be intentional about putting supports in place, as unnatural as they may feel, in terms of Zoom calls and, taking walks outside that you normally might not do. But we really need to do that to reduce isolation, because isolation is a big risk factor for suicide. And so if you are worried about somebody who has been struggling potentially prior to the pandemic even, or whose mental health has really been declining during it, staying connected with them is the number one thing we can do right now, and not let anyone kind of fall off the radar or become isolated. That's something we all really need to be active and intentional about.
Yeah, and it's, I'm seeing even more so now, to follow on what you said, lockdown was a long period, but it feels almost that we're in this like state of limbo. And, there's a little bit of hustle and bustle. Some people are going back to work, schools are opened, but there is this, I think I'm definitely seeing in my small interactions, like from day to day, how this has affected individuals and what that means to relationships as well. And I've definitely found that I've had to even more so empathize with how this has affected everyone, because, it's in those interactions where someone might be a bit off, or they, we spent so much time in our houses. It's like, oh, I don't even know how to have these conversations. I don't even know how to like sit at a table with loads of people that aren't my family, or
right.
I was isolating by myself and I ate with my hands. I don't know what you did, but it's been a weird state, I think. And I've been finding this limbo period a lot harder than the actual lockdown itself. But this is a question to all of you. A recent study conducted by the global nonprofit CARE found that the pandemic has disproportionately affected women's mental health around the world. In what ways are you seeing this play out in your work?
Well, we are I'm here in Geneva, in Switzerland, in a big office with around 3,000 people, usually coming to the office at the beginning, the lockdown. We had only, the WHO has been working heavily all the time, right? But in the office, we had only emergency colleagues. And so my team, we were at home. At some point, I was the only one as director that was allowed to go after a couple of months. And it was very lonely to be there. And so I will not see anybody all day in the office. I will come home with my husband. And then at some point, we were allowed to invite more people coming. To my surprise, in my team, only men were the first ones to raise the hand saying, I want to go back. And when we were joking among us and trying to analyze, we were understanding, we were interpreting the issue in a number of ways. On one hand, maybe men are more structured to be out of the house, out of their home, working somewhere, and like back to old models. And I'm talking about young colleagues, not old or old mind settings, but still, culturally, it was the most natural issue to go out.
I think something that's so interesting to hear, and I think something that we've all seen across the board, is that as much as things have changed for women, the domestic sphere remains a place where we place an enormous amount of pressure on women. And so even as men can pick up more slack in homes, the global pandemic has placed pressure on the domestic sphere. We're in lockdown in our homes, and homes become a domain where women experience the majority of pressure. And then therefore, there is an increased pressure on women in a location where they are expected to perform at a high level and in some way be responsible. And now they are women in some way used to experience perhaps an oasis in their workplace that was separate from these domestic pressures that they would experience at home. And now both things have been collapsed. And so work is now on top of child rearing or pleasing a partner, or we're hearing more and more about women who are stuck at home with partners who may be abusive or violent towards them. And so we're seeing increased rates of intimate partner violence. And that's the kind of thing I think women all over the world should be concerned about and should be thinking, how can we be supporting our female colleagues, and how can we keeping our eyes peeled, because we may be making assumptions about the home lives of our female colleagues that are rabidly incorrect, because our female colleagues may be keeping up appearances may have previously been able to keep up appearances at work that were not actually accurate. And so now there are women who are having to kind of express to their bosses that they don't have proper childcare, or that they don't have 50-50 support from a spouse, and who are now facing the wrath of bosses who don't understand that can look different for men and can look different for women. And so those are the things I'm hearing about in comments on my Instagram page, in stories from friends, in articles I'm reading in the New York Times. And those are the kinds of things that really concern me when I think about this place where women are now going to potentially be stuck working from home for not just a few months, but a year and a half, and ad infinitum, until we really understand what this is going to look like, and how do we support women's mental health as they navigate this odd interstitial space.
Mm-hmm. What about you, Ciara?
I echo everything that both Dr. Kestel and Lena were talking about in terms of just how much women do in the domestic sphere as well, and that the schools not happening or happening in a remote way. I think the impact of that, and I'm seeing it certainly with folks I work at, I mean, it's really, the stress of that is huge. Not just the stress of trying to work with children at home, but also being quite worried about children and what's happening to them in this, and feeling that overlay of being responsible for their well-being, as well as kind of navigating your own job. And, I was reading something recently, and we were talking about kind of how many women are leaving the workforce, right? And either they're choosing to do so, women who have more financial freedom to do that, they're choosing to do so to be at home for their kids and manage Zoom school and things like that. Or else, many, many women are, fill the jobs of kind of more lower income jobs that have fallen away during this pandemic. And what's happening is that we're not seeing them kind of looking for work. They are falling out of the workforce, but then they are being absorbed into having to take care of not just young children, but also parents. We should really be thinking about, when that often is a burden that kind of falls on women to look after elderly parents in the home as well. And that there's more and more research about how stressful that has been during this pandemic to keep them safe. But I think, it's for all of the reasons we're talking about here. It's incredibly profoundly impacting women. And I do think we should keep an eye on how this is going to impact long-term in terms of women in the workforce, and what happens during this period when many will step away to try and manage this home life situation.
Yeah. If I may add, just to what you were saying, in a way, some pre-existing situations that are being exacerbated. That's what we are talking about, right? I mean, everything that has been said, it was before and now is more. Mm-hmm. And so the issue is, what can we do? How can we think in order to activate ways for the way forward? But definitely there are efforts in order to make sure that women in particular situations are changing. I was a bit also distracted because I'm sure all of us interact with some in some countries and with some situations, while when you look about what's happening in other countries, much more challenges are there, and the situations of women are really, in many cases, seriously affected, right? So what is going to be the way forward? I think it will need more interventions like the ones that you are doing, movements that activate really girls and women to find alternative new ways to deal with the situation.
So I want to talk about lived experience, and this one is for you, Lena. You've spoken a lot about your own struggles and the path with mental health. How has the pandemic impacted your mental health? And you've spoken briefly about the coping mechanisms that have been helpful to you, but I think it would be great for not only for anyone listening, anyone who decides to click onto this when it becomes live, to know what steps you're taking.
I feel like the most important thing for people to know about mental health is that it's not a linear journey, and that all of us who have struggled with our mental health are not people who were broken and then became fixed. We're people who are going to spend our entire lives understanding that we have our own unique set of wiring, that we are always doing our own form of battle with, but that we can learn our own kind of our own unique tips and tricks that work for us, so that it doesn't have to be such a terrifying struggle each time we understand when certain challenging moments start to approach. And then we're able to go, okay, I've been educated in certain methodologies that work for me, and I know what to grab, and I have this set of tools. And if one doesn't work, then another one might work, then another one might work. And so I feel really lucky that since I was, 7 and was lucky to have parents who were supportive enough to put me in therapy, I've been able to try things as diverse as therapy to transcendental meditation to forms of mindfulness and, full body relaxation and the things that I really lean on now in my adult life. What I've really found is that it really is a combination of working on my sort of actual like biochemistry, which I work on through by taking medication and working on my sort of sympathetic nervous system through various forms of meditation. For me, transcendental meditations, TM, has been an amazing form, but lots of people find that mindfulness and various forms of meditation that are as easy as downloading an app work incredibly well for them. And those are things that can actually, have been scientifically proven to be incredibly that have actually proven to make changes to the way that our brains wire themselves. And then the other sort of two components for me are therapy and community. And so for me, therapy has been an incredible tool, being able to talk about trauma, really talk about trauma and what that does to your brain, especially as a woman, and to engage that as a piece of my mental health journey. And I think also when you are a person with mental health issues, there are certain traumas that have befallen me, it's a what came first, the chicken or the eggs type of situation. And then the community I found as a sober person, the community I found as a person who talks about mental health issues online, that I found with other women who have mental and physical health issues. And so especially during this pandemic, I've just tried to make sure that I just hold tight to the things that kept me going in the real world. So making sure that that I don't give up on therapy just because I'm not able to go into my therapist's office, making sure that I don't give up on the friends and community that I made because we can't all go and meet up with each other. And so as much as, a big Zoom call organizing a Zoom call and sending out a link is not something that I would probably do. I am not that kind of community go-getter. I'm not a party thrower. I'm not any of those things. But I had to try to push myself to become those things. I remember at the beginning of lockdown, I was living with a friend who was doing Zoom yoga and Zoom cocktail parties and Zoom movie club. And I was like, I will never be this person, but I guess I am going to be the person who does Zoom. We're going to talk about our depression club, and I'm okay with that. And then making sure that every single day I'm asking myself, did I meditate? Did I use the mindfulness tools that I have? And if I literally don't have the ambition to meditate, was I able to listen to a guided meditation? Was I able to listen to a tape? Thinking about what is my ambition level? What am I capable of today? And I'm just going to rise to that today and do something that works for me. Because I think it's easy to think you're immune to loneliness, and none of us is immune to loneliness. And loneliness is a very primal human emotion that is able to twist almost any circumstance to its kind of evil means. So I think that it's an important time for us to hold each other accountable in a really loving way to using the tools that we know work for each other, and asking our friends, just asking your friends, what are 3 things you're going to do to make yourself feel good today? When your friend calls and is I've had friends say that to me, when I call and I go, I feel like shit. And they're like, okay, so what are you going to do to make yourself feel better? And that's the most comforting question in a certain way. Just a friend reminding you that you do know how to soothe yourself. You're just forgetting that you have the tools because you're forgetting that they're at your disposal.
Yeah. And I think so beautifully put, Lena. And I think you also have to ask yourself that. There have been many times during this lockdown when I've really had to sit myself and ask myself what I need. And I think because one's mental health journey isn't linear, and it has big bumps and small bumps, and I've had many epiphany moments during this time where I've had to look at these bumps as not setbacks in my mental health journey. I think because I started off this year in quite a good place, and this has been so overwhelming. I was off medication. I've had to go back on medication. It took me, I'm a stubborn Taurus, and so I thought I could do it my own way, and I was, before the pandemic, I was leaning on the fact that I was busy and I was able to throw myself into exercise, and I didn't really have that much time to sit with myself. And there are positives and negatives to that concept in itself. But I think I've really during this time had to pull on those tools, the ones that are at my disposal right now, and not look at going back on medication as a setback, and actually something that I need right now. What is going to make me feel better right now? What is going to make getting out of bed and realizing that I do have a purpose today, maybe not tomorrow, but today I have a purpose. Maybe that's medication. Maybe it's reaching out to a friend, which I also find quite difficult. And I know definitely lots of people find difficult. Yeah.
And not shaming yourself for what you need on any given day, because I think people want to think of it again as this sort of linear forward motion, which is, no, I needed medication 5 years ago, or I needed my friends all the time 5 years ago. And it's we're going to need different things on every single day of our life to be able to navigate what the world throws at us. And that's okay. And it sounds like you've really been able to tell it, just to be able to tell yourself it's okay that you need medication is an amazing and mature accomplishment in and of itself.
We all have a role to play, in protecting our own mental health.
Yeah.
We always do, but in the current situation, the challenges are bigger, and so we need to be more aware and more committed to our own mental health. And I think that's valid for everybody, no matter where you are at the beginning of the pandemic in this case.
No, I think you're
and
so right. It's a responsibility to yourself. And I think you have to be so in tune with yourself. And I think that's quite scary. But being in tune and being like, you know what? I don't need the pressure of 10 million Zoom calls today. Maybe I'm going to stare out the window. Maybe I'm going to read a book. Maybe I'm going to do, I'm the same as you, Lena. I was never about to do like Zoom yoga or Zoom cocktails or any sort of like, question time on Zoom. I'm just not.
Totally. No question time.
But a long conversation about, depression and all that stuff. Yeah, count me in.
Totally.
About feeling.
This is my dream Zoom.
Yeah, but I think you're so right, Dr. Kestel. It's a responsibility to yourself and a commitment to your own mental health right now.
And it's also quite, I'm hearing it's so individual too. I think I see a lot out there about like self-care, and sometimes I like bristle at that, even though I'm a psychologist and that's an important thing. But the term can sometimes be, that's like, right, yoga or a bubble bath or like something that's not the way I need to take care of myself, and so knowing what works for you, which you guys are so beautifully kind of talking about what that process has been like to learn about kind of your own, where you are at different places and what's possible and what helps you kind of re-regulate or whatever it might be. And that's going to be really different for everybody. And so putting together that sort of toolbox, I guess, of things that work for you is really important. And then I think another piece of this time, I like to think about it kind of in a positive way and reframe it in some ways that, we're all going to come out of this period different, right? We're all going to have changed. We're all going to grow in different ways, right? And there is an opportunity here to kind of be active maybe in that growth process and to use this time also as a reflection. So many things were kind of just wrenched away from us in our lives. Like, what do we miss? What can we do without? How has this changed our priorities? How has this changed what we want to do when this is over? And to kind of use this time to reflect and, create meaning, certainly as a suicide prevention specialist, meaning is so important. But I think there is an opportunity in a painful, scary time to also be active in the resilience building and in the kind of inner conversation and what you're learning about yourself. To come out of it, changed for the better in some way. And
this is a question for you, Ciara. At Girls Talk, community is everything, and we've always sought to create a safe space for girls to be able to share, listen and learn, and lean on each other for support. Can you tell us a little bit about the importance of shared experience and community, especially in these difficult times?
These types of open conversations about both what we struggle with, but also how we've taken the brave step to get help, and that there's nothing wrong with that, and that help could look all different ways, from medication to therapy to meditation to, cognitive reframing skills, whatever it might be, that you guys telling that story, and then whoever is listening to this who is struggling and who is alone with it and who feels quite hopeless as to how to even begin that next step, to hear you guys even have that casual conversation just now could really, really impact somebody's kind of view about accessing care, right? There's so many barriers to care and mental health. So, and there's so much stigma. So part of what we do at Girls Talk, what you've been doing, Adwoa, what you are doing, Lena, as well, and I know Dr. Kestel is doing on like a more global level, is really trying to reduce that stigma and increase access to care. And part of reducing stigma is having folks who have struggled and who have gotten help tell their stories, which I think we always encourage in our Girls Talk community when they're ready. That's the piece. It's I'm sure for each of you, it was a journey to kind of figure out when you were ready to share some of this. But it can really quite literally save a life. People hearing that they're not alone, they're not the only ones who have struggled with this. And sometimes I feel, like as a shrink, I could talk to like I'm blue in the face about the importance of all of this, but but you guys and people with lived experience sharing their stories, that's going to really impact and touch somebody and change their view and reduce that stigma a million times more than kind of I can from a sort of academic place. So I think that's really important in our community and Girls Talk and in general.
Thank you, Ciara. And over to you, Lena. How has your mental health journey informed your film and TV projects? How can art contribute to efforts to destigmatize mental health?
I mean, I think that whenever I'm writing and whenever I'm reading a project to produce and whenever I'm thinking about what I want to put my name on, it's always about, does this story have something to say about making sure that people understand that mental health is personal and mental health and talking about your mental health is powerful, and that no two mental health journeys are the same. And really having characters who are interesting, neurodiverse characters on television and in film is deeply important to me. And I remember the first time that I wrote about my character's mental health on Girls and her obsessive compulsive disorder. I was so scared. I didn't think anybody was going to relate. I thought I was writing something that was like the moment I was going to completely lose the audience to some weird storyline that was some archaic storyline that no one understood. And it was a storyline that more people understood than I could even believe. And that was a moment that was such a light bulb for me. And so it was like there was no downside ever to talking about these things. And I went from thinking, as a kid, like I would, when I was coming back from therapy, like make my parents walk me like 10 different ways around the block in case somebody possibly saw that I was walking from a therapist's office towards school, to knowing you could talk about these things on TV. Wow. Like I've had lots of challenges about talking about different things in my career, and lots of moments where I've maybe wished I didn't say things out loud, but never about my mental health. And that's an amazing lesson. And so people want to hear about this stuff and they need to hear about this stuff. So I think that it's, for me, I'm saddled in and excited to just over the long haul talk about these issues, and always try to do it in an honest way that never increases stigma or makes people feel like they have to address these issues in silence. And conversations like this inspire me to go back to my desk and keep doing that. So thank you.
No, and I want to say, Lena, thank you for writing about Hannah's mental health and her obsessive compulsive disorder, because it really, I can't tell you, it'd be a larger conversation, but it definitely really helped me back in the day when that show first came out. So thank you. So to finish this beautiful and much needed conversation, Dr. Kestel and Ciara, as we enter our 7th month of lockdown and the pandemic, what can you give the listeners, what tips can you give the listeners to maintain their mental health?
Okay. No, the previous conversation about protecting our own mental health, I think, is crucial. And there are some basic self-care strategies that we all can put in place that sometimes may seem insignificant, but they do make a difference, like eating well and doing some physical activity at the level that we can and according to the conditions we are living in, but some kind of physical activity. We need to make sure that we sleep enough. We need to make sure that we get some rest also from all those hours of Zoom chats that are tiring as well. We need to engage in activities that we enjoy, whatever they are, even playing with a dog, if that's what we have, which I miss so much. I envy your dog next to you, Lena. And a hobby for some, reading a book, going around the corner. I mean, do something that we do like. And then there are the basic issues more specific to the to the lockdown, like, the routine, getting up at some time, going to sleep at some time, having breaks at some time, and maintaining, for those who work from home, maintaining the routine and not pretending that the day is not ending and the weekend is never happening. For those of us who have a Monday to Friday routine, how to maintain that. A bit, that is basic issues that are important. And then, of course, for those who do have some other more significant distress or mental health issues, do not hesitate to reach out to those who were helping you before or others that could help. That could also be somebody, what you were saying before. Grab the phone, grab the email, and send a message and reach out to somebody you can talk to. Do not let it pass. Do not let it go. Medication, no medication, talking therapy, not talking therapy, mindfulness, yoga, whatever it is that helps you, this is the time to reach out to that and make sure that you get that for your own mental health. I would stop here.
I mean, that's such an amazing.
I'm writing them all down.
List. I know. Me too. No, I mean, you sum up so well in terms of the things which, by the way, is a lot to try and be doing and trying to be intentional about in ways that we didn't necessarily have to be previously. I'm a New Yorker. I would commute. I would walk a lot in my day. It just was built into my life, and that's totally gone now. So even those little things, now I have to be intentional about going for a walk, being active. This is all new for all of us. So everything, Dr. Kestel just laid out are exactly the things we need to be trying to kind of incorporate. And then I would just again stress, and this is certainly my concern, but as this goes on, staying connected as much as you can. I think it gets more exhausting and harder to kind of do that, but it really trying to reduce that urge to kind of isolate or just be like, I can't anymore, which I think we all feel at times. So staying connected and really being kind to yourself in this. I talk to a lot of folks particularly who are caregivers, whether they work in the helping profession or just are helping type people like you all, or have young children or, grown old elderly parents they're taking care of. They're just so exhausted and they're giving everything to everybody else. And so I'm also quite aware of those folks that, for the lack of sound, this might be such a cheesy thing, but that whole idea of putting your oxygen mask on first, you have to prioritize all the things that you need for yourself, because then you are going to be able to help. But without doing that, the risk of burnout here is really, really huge. So that's even kind of another layer of this. But again, I think in the most basic level, let's all be kind to each other and ourselves about kind of what we're going through, take care of each other, check in on people you're worried about. All of these things I think are going to be important. And then this is on some level an opportunity to grow and change and to reflect during this time. And I think there are ways that can happen too, so that we come out of this changed for the better in some ways, kind of our internal landscape as well. So just some thoughts.
No, thank you, Ciara. And I think I was going to end it differently, but we've all spoken about the wider issues, whether it be globally or in our own communities. But I want to know from you three, sounds like quite a kind of basic question, but what are you looking forward to? What are you excited about? What can you not wait to do once we get some sort of, whether it be a new normal, let's say a new normal back, not the old normal, but a new normal back. What are you looking forward to doing?
I think doing things like this in person and being with women like this again in spaces where we can feel each other's energy and give each other hugs and just be engaged with each other in a real, human to human way.
Mm-hmm. That's huge.
Either the hugging, for me, I'm a hugger. I hug everybody. No matter what country I'm in, I'm already going for a hug. And that's back then. I look forward to that possibility again. I want to hug my mom. My father passed away at the beginning of the pandemic, and I couldn't travel and I couldn't see my mom. So I want to hug my mom. But I also want to hug you guys, hopefully at some point in the near future.
Yeah.
Hugging is key for us. My way of seeing the world.
It's so funny because Adwoa has asked me this before, and hugging is exactly my answer too. So there must be something. But I also, like you were saying, like just being able to jump on a flight and come see you, Adwoa, in London, or Lena, us connect in LA, and just having that freedom to kind of be a part of the world again and move around and make things happen that are good like this, and be together and move these conversations forward. It's gonna be great, and we're gonna do it. Let's make that pact that we'll get together at the end of this again.
Thank you so much for bringing us together, Adwoa. It's really
yes.
Yeah.
Thank you so much. And I would ask anyone who's listening to ask yourself that. What are you looking forward to? I think it's something that's definitely pushed me through the days, whether it be dancing or, everything that I've learned during this time. The fact that I can't, I'm ready to fall into a relationship. I want to, all those things that maybe I would have taken for granted. I'm looking forward to actually putting a massive amount of effort into them. So yeah, ask yourself that. And I just want to thank all three of you. I don't have the words to explain how much this means to me. And I'm so grateful that we were able to have a conversation like this. I think I can't even believe, my younger self would have done so many things to sit here and listen to you three. So I'm so glad that at 28, I'm able to sit with three phenomenal women and have this conversation, an honest and raw conversation, and really put it all out on the table. So thank you very, 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 very much. Yeah.
Thank you, Adwoa.
Thank you for the work you do.
Sending you all so much love.
Yeah.